defibrillator uses a set of paddles to deliver a high energy, high voltage shock to the heart so that all the cells will be depolarized almost simultaneously. When this is delivered for a ventricular fibrillation, there is asystole for a short period, and soon the dominant pacemaker of the heart recovers and sinus rhythm is restored. That is how defibrillator works in management of cardiac arrhythmias which are not amenable to treatment by medications. It could be ventricular fibrillation where there is only one treatment, that is defibrillation, and in conditions like ventricular tachycardia and supraventricular tachycardia, it is known as cardioversion rather than defibrillation. There could be medical options, but if they fail, we go for defibrillation or cardioversion. These are representative external defibrillation paddles. There is another known as internal defibrillation during cardiac surgery. Two paddles are directly applied over the heart. That is internal defibrillation. Still more are there. There were catheter-based defibrillations, and the more common one nowadays, other than external thoracic defibrillation, is implantable cardioverter defibrillator, where a device is implanted in the pectoral region and the electrodes are placed within the heart, usually one in the superior vena cava and another in the right ventricle, where the shocks are delivered within the heart for immediate management of arrhythmia. That is, the device known as ICD monitors the arrhythmia, and whenever there is need, it will give a shock directly, which is lower energy than what the external defibrillators give. Now, what are monophasic and biphasic defibrillators? Monophasic defibrillators give shock only in one direction. Suppose this is taken as positive and this is negative, only unidirectional shock is given. That is represented by this monophasic waveform. When that is given, myocardial cells near the electrode get more of energy, and cells away from the electrode get less of energy. So some of the cells may not be depolarized by a monophasic shock. In biphasic shock, what is done is, initially a shock is given in one direction and then the polarity is reversed. That is what is. So that it will mop up the cells which are not depolarized in the initial phase of the defibrillation. And this is known as a burping effect. It will remove all the cells which are in the polarized state back to depolarized state. They say that energy requirement is lesser for biphasic defibrillator. If you have checked older defibrillators which are monophasic, you would have seen that they have a maximum energy of around 360 joules. While most of the modern defibrillators which are biphasic, they have maximum energy around 200 joules compared to the 360 joules. There are some biphasic defibrillators giving higher shocks also. That is because sometimes resistant fibrillation may require higher energy shocks. In the cardiac catheterization laboratory, during electrophysiology studies, sometimes they use even 2 defibrillators simultaneously discharged to treat arrhythmias which are refractory. That is, dual defibrillator use simultaneously. So there are situations where higher energies are required. But usually monophasic maximum is 360, biphasic maximum is 200. And the higher the energy you are going to deliver, the more is the myocardial damage. That is probably one reason why biphasic has an advantage now and monophasic has almost been phased out. we'll know a little bit about the physics of the defibrillators, or rather the electronic side. The voltages usually given in biphasic defibrillator is an enormous 2500, in the range of 2500 volts direct current, DC. Whenever the defibrillator is used in AC, it is stepped down initially into usual battery voltage to charge the battery. Often the defibrillators work much better on the battery. Direct current from the battery is converted to a high voltage by a voltage multiplier circuit, and it is stored in a capacitor, high value capacitor, for a short period when you are activating the defibrillator. That's why you can see charging in the defibrillator. And when the battery is weak, charging times are going to be higher also. And after charging, it is delivered, shock is delivered. And you can imagine the high voltage. And that's why we always shout, the operator always shout, all clear, before you deliver a defibrillator shock. Otherwise, anyone touching the person or the subject is also likely to get a shock. That's why everything is removed. And good preparation of the site is also required. If the site is not having good conductivity, that is with jelly, electrolyte jelly is not placed, then there is every chance that skin burns can occur. And while applying also, you should give adequate force. That is, the paddle should be pressed on the chest, so that now the defibrillator paddles have sensing of thoracic impedance. They sense the thoracic impedance, and green color indication will show that you are pressing properly and the jelly is applied properly. Otherwise, red color might be shown on the paddles. And after sensing the thoracic impedance, the device can adjust its internal resistance so that the set joules are delivered properly, because everything is computerized. The devices, modern day defibrillators, are now just delivering the shock. Then they can also synchronize. In cardioversion, it is synchronized to the R wave, so that it does not induce fibrillation by itself. So there is a lot of technology involved in a defibrillator. Thank you.